I wanted to talk to you today about headaches, and if your headaches are back here on the side or in the front. My name is Dr. Romina. I am the founder of Think Healthy, and my practice is in Los Angeles. My goal is to help people have better health during this COVID crisis. My knowledge, my experience is offered to you as a community service for free. I like to share with you, so maybe we can have you have a healthier life and better life as we go through this process. All right. I do want you to take a survey. These PowerPoints are available to you on our website. So please take the survey, find out where you are, where is your health scope, and what you need to do about it. And we are here to help. Every Wednesday, we have a Wellness Wednesday, which means that we pick a topic, talk about it, and find out the natural solutions rather than trying to keep you away from drugs and surgery as much as possible. During this COVID crisis, the problem is if your immune system is low, which is immensely affected by pain, then you are more susceptible for injury and damage and contaminate and being affected. So get rid of the pain, build your immune system, be stronger so we can all go through this process healthy, and let's just be another journey, another challenge in the journey of our lives. Okay, well, let's talk about headaches. So what exactly is a headache? Headache is either muscular or it's vascular. It's usually, and it's also chemical, but we're going to talk about the manifestation of pain is muscular or vascular. So when muscles or blood vessels are swollen or they get tightened, which means constricted, they go through a changes that stimulates all the surrounding nerves. The nerves are the ones that portray the level and the intensity and the type of headache you have, whether it's deep, dull, sharp, stabbing, or if it is a 3 out of a 10, 5 out of a 10, or a 10 out of a 10, or some of you who suffer from migraines, probably a 12 out of a 10. So these nerves send messages of pain, and that's where you experience headache. Actually, 90% of the headaches are not in the head. They're usually from the peripheral area. So first and foremost, if you do have a headache, you want to make sure that you check with your medical doctor and you make sure you get an MRI or a CT scan, depending on what's recommended, to make sure that the brain itself is healthy. Now, here we go. Now, what are the types of headaches? So let's talk about that. There are multiple types of headaches, but the most common ones that I could share with you are sinus headaches, cluster headaches, cervicogenic headaches, tension headaches, migraine headaches, and TMJ joint headaches. Sinus headaches typically occur where the sinuses are, which is right here, your frontal sinus, your zygomatic sinus right around here. You get a lot of stuffiness, pressure, just you feel like your head is about to explode, which we'll go into detail exactly which one, what type, and how each headache is. Cluster headaches are always unilateral, and they tend to happen behind the eye. Then you have your neck headaches, also known as cervicogenic headaches. Cervicogenic headaches start back here and travel up. And then you also have your tension headaches, which is that lands over here, typically caused by problems at the base of your skull. And you have your migraine headaches, which usually are unilateral. They have symptoms of their own, and TMJ problem. So temporomandibular joint, every time you press your jaws together, they do cause headaches that are usually temporal. Now, let's talk about the side effects, who is affected by headaches. Now, an average adult about the age of 18 or older gets severe migraines. And it's usually typically female for hormonal headaches, and men also get headaches, get more cluster headaches. So about half to 3/4 of the adults between the ages of 18 to 65 suffer from headaches. 30% of the headaches are migraines, and they are the #1 reason people reach out for medication. And they're the most neglected because most people think they can handle it themselves. So right now, it's affecting a higher population and there's a rise in headaches. Reason being is, how many of you are slouching right now? If you're slouching, or if you are on your phone, or you have children or spouses or friends or family who are slouching on their phone and they're beginning to have this forward head carriage, that's the underlying cause of many cervicogenic headaches, which is on the rise. Sinus headaches are usually pressure and pain that's around behind you on your sinuses. They're worsened pain as you bend forward, you feel stuffy. And no, I don't have sinus headache, I do have stuffiness. And then you feel very tired and you feel achy, and you start feeling pains in your upper part of your teeth, like around your zygomatic arch. So if you touch your facial bones, right around your cheekbones, you roll down, you move about half an inch, that's where you find your sinus headaches. The next set of headaches are your cluster headaches. Cluster headaches typically are unilateral. They're pain around the eyes. They cause a little droopiness, running eyes, tearing or redness in your eyes. That also affects. And you have these blockages, that there is a blockage drainage to your eyes. And your pupils get smaller. So you really want to make sure that, you check yourself in the mirror as well. Now, let's talk about cervicogenic headaches. This has become the most popular and the most common. And the reason being that is cluster headaches, cervicogenic headaches are aggravated by forward head position. So if you look at that PowerPoint and look at the skeletal images or the green stick images, which one of them do you feel at the end of the day? Or do you find yourself? If you find yourself slouching, it's becoming the #1 cause of headaches, the forward head carriage. Why is that? Your head weighs about 8 to 15 pounds. For every 1 inch that your head, like the image in the first one, right here, for every 1 inch that your head is more forward compared to the rest of your body, there's an extra 10 pounds of pressure on your upper back, and there is almost 3 times more, which is about 30 pounds of pressure in your lower back. The problem with cervicogenic headaches is that means the neck is already being affected. And the bigger problem with that is the nerves that exit out of your neck feed off to your hands and fingers and your arms, causing radiating pain. So forward head carriage will cause headaches, would also cause degenerative disc problem, neuropathy, degenerative joint disease, as well as nerve compression to the nerve structures that are coming out of your neck area. So taking care of cervicogenic headaches are essentially important for your overall health. Now, tension headaches are usually, I call them angry headaches because it is caused by stress. And you feel like there's tightness around your head. Your head feels very tight, or you have a constant dull ache on both sides of your head. Unlike cluster headaches, which is usually one side, or migraines that are unilateral, tension headaches tend to be more bilateral. And the pain spreads from the neck to the head. Whereas with cervicogenic headaches, you get the headache and it dissipates all the way down to your mid-back. So the cervicogenic headaches are mid-back, between your shoulder blades, upper neck area, and the head itself. Migraines. I'm sure a lot of you are suffering from migraines. I became a chiropractor because my mother suffers from migraines. And I just wanted to be a doctor that didn't give drugs because it didn't help her. So that is my story. That is my journey. Maybe you have another one, but I hope this is migraine headaches are very personal to me. So I'm very sensitive about it, and I'm very empathetic towards people who are suffering from it. Migraine headaches are vascular headaches. They're not muscular headaches like the other ones that we discussed. Migraine headaches usually people start after their puberty or the ages between 35 and 45, typically goes away by the time that you have menopause. It's more common in women because it's aggravated by hormonal dysfunction. People who get migraine headaches tend to have a lot of skin issues as well. It's more in common in men than women. But the hormonal influences are huge. You do get an aura or a flash of light. You get an aura that something speckles are coming in through your visual field. You feel it coming, so you know it's there. There is nausea involved with that. There is uh, visual disturbances involved with that. The aroma is bothersome and aggravating. The light is aggravating. You have photophobia, and sometimes you can't even eat at all. The reason for that being is migraine headaches are generally caused by the pain in the base of the skull. The only place in the entire body where something as delicate as an artery pierces the most toughest tissue in the body, bone, is in your neck. There are on each side of your vertebra, there are two pathways of vascular pathways that pierces the bone to have extra blood supply to the brain. When these vascular system is compromised, you get that throbbing, pulsating headache. Those throbbing, pulsating are basically are the vascular headaches. That's an expression of a vascular headache. And what you can do is you can definitely minimize the progression of the headache and minimize the intensity of the headache as we discuss further on in the PowerPoint. And I'll teach you what to do in order to minimize it. Then we have the temporomandibular joint, which is the TM joint. That is improper positioning of the temporomandibular joint. If you want to find it, take your thumb, put it in front of your ear canal. Just slightly bring your fingers forward about 1 centimeter or half an inch forward, and 1 centimeter or half an inch down. And as you open and close your mouth, you should feel these two joints move under your thumbs. So when there's an improper positioning of the temporomandibular joint, sometimes caused by forward head carriage, sometimes caused by bad sleeping position, caused by scoliosis, caused by forward head position, or improper or prolonged dental surgery when the mouth is open for too long. So you get tight facial muscles, you have jaw pain, you feel clicking or popping of your jaw. There's a restricted movement of your jaw, so you can't open your mouth as wide as you want. There's limitation. You can't bite down on hard stuff such as a caramel candy. And you notice that there's a change in your bite. So you either have an underbite where your lower teeth are more forward compared to your upper, or upper teeth more forward compared to the lower. So they're usually very similar to your tension type of headaches, which is also a muscular overload. Temporomandibular joint headaches are a musculoskeletal headache, which falls into the muscular aspect of the headaches. So after all that pain and discussion about pain and location and discomfort, what are we doing? What are your treatment options? So using heating pads, relaxation, meditation, taking ginger, moderate exercise, dimming the light are all helpful factors for alleviating. But let's get to a little bit more nitty gritty and finding out how we can help you. All right. So if you have a vascular headache, you're going to put an ice pack on the location of the pain because you want to reduce vasodilation. Why you want to reduce vasodilation is because if the blood vessels are dilating, they're forcing more blood through and it increases the pulsation or throbbing sensation of pain. So using an ice pack causes vasoconstriction to the vessels, which allows you to reduce that pulsating, throbbing pain. But remember, we talked about migraine headaches being a vascular headache, but they usually stem from the neck. At that time, you should definitely put a hot pack on your neck. So you use a heat pack on your neck and an ice pack on your forehead. The combination of these two at the beginning of the migraine are very effective. But if you are experiencing migraine and you haven't done anything about it, and let's say it started at work, or for some reason You're already halfway through your cycle of your migraine. You want to use heat pack on your neck and heat on your forehead as well, because you really want to relax and calm the nerves after being agitated for a period of time. You try to avoid any stressful situation. And if you can, situations or conditions that causes you to be under stress, avoid that. For people who are suffering from pulsating headaches, do not take MSG. And MSG is predominantly found in Chinese food, which is a main ingredient of Chinese food. So be careful of MSG and stay away from it. Other chemical aggravating allergic reactions are gluten and lactose are also other factors that could affect you. Now, make sure you exercise regularly. When you exercise regularly, your muscles and your blood vessels are continuously in motion. Motion is life and it increases energy. Therefore, it's very important that you exercise. Limit your alcohol. Alcohol causes vasoconstriction and causes suboccipital contraction of the muscles, and it will give you overall headaches. And if you don't believe me, I'm sure you've experienced a hangover. Should you experience a hangover next day after alcohol consumption, make sure you lay on the side of the bed with your head hanging, put a heat pack on your forehead, put a heat pack on your neck, and bend your knees with a couple of pillows under your knees and go to sleep for about 10, 15, or 30 minutes. That will get rid of your hangover. And the reason being is you promote the cervical curve, you relax the suboccipital muscles, increase the vascular flow to the brain, and that would help you. And make sure you go for a walk outside because you do need to oxygenate yourself, your blood vessels, and your soft tissue. What are your treatment options? So you could definitely get the over-the-counter medication or any kind of anti-inflammatory non-steroid, especially for your sinus headaches. You want to contact your doctor to get a prescription if the over-the-counter products do not work. What you want to do, you also want to be careful not to suffer from the side effects of medication. So read the side effects so they're not aggravating your headache. That's very important. Now, there's also other treatments. Now, here we go. One of the things that I want to talk to you about is posture. Your posture plays a huge role on your overall wellness of your body. And having a poor posture can cause the tension, the muscles in your upper back and your neck and your mid back to be in an abnormal state, which by connecting to the spinal vertebrae, they will shift the body and create and put you in a situation of headaches. So your upper neck muscle in between your shoulder blades that are caused by forward head carriage, slouching, poor sitting position, texting, are aggravating your muscles that cause headaches. They will cause cervicogenic headaches, they will cause tension headaches, and they make you susceptible or prone to migraine headaches. You could definitely get a posture product. I do recommend BAX-U because BAX-U is the only posture product in the market that, one, made in America, two, does not compress your armpits like the other products do, and most importantly, it's backed by university studies of University of Michigan and corporate wellness studies to prove that wearing BAX-U posture support improves your posture by 90% over 12 weeks. So put it on, don't worry about anything, it will take care of you. What BAX-U is to your posture is what a dental floss is for your teeth. Yes, it is important to take care of and prevent damages, and you can do that by supports of such. Now, going back to headaches, and we talked about how headaches are mainly caused by upper back and neck problem, it's important that you take care of your neck as well. And how that works, there are products currently either on our website or you could get it from Amazon on the market that is called neck hammock. Now, if you are suffering from degenerative joint disease, if you have neck arthritis, if you have numbness and tingling in your fingers, and if you're experiencing radiating pain to your arms and hands, neck hammock would give you great relief. but it will not correct the curve in your neck. It would just traction the neck so the body has a chance to relax. When you stand up and you go back to your normal activities, it will go back again. So the neck traction is good to alleviate numbness, tingling, and pain in your arms and fingers. And it also relaxes the neck muscles if you are a constant computer user. Better than that, what I recommend to my patients is the chiropractic neck support. No, this is not something I invented. This is something that one of my colleagues did a while ago, but I highly promote it. And the reason being is I recommend this chiropractic neck traction to patients because it promotes the curve in the neck. So it helps you to have a better curve in your neck, tractions the head using your head as a ball and the neck as a chain to traction that ball and chain reaction. You could also get it on our website or you get it on Amazon. And there's other instructions that I could provide for you where it could help with headaches. Again, an ounce of prevention is better than a pound of cure. Please make sure that you take your preventive measures, get the supports that you need, get the equipment that you need, and seek out help. If we can help you, contact us. We are an email away, a phone call away in order to help you. My name is Dr. Romina. Every Wednesday, I come in to share the message of health and wellness. Our next topic is going to be specifically about neck. What are the neck problems, what you can do for it, and what you should expect after these products, and how to screen your own family. So that way, instead of coming to the office, you would already screen your child or your spouse or your loved one to make sure that they live a healthier life and take proactive measures yourself. My name is Dr. Ghassemi, and thank you so much for being here today.